Veronica, Beth is very, she knows about ODMAP and is very familiar with it. So I'm sure Veronica can start and she'll join us in a couple minutes.
All right, then let me, Terry, why don't you take us live? I'll do a brief introduction, and then I'm going to have Katie introduce the speaker, and we'll go from there.
It says we're streaming live on YouTube now.
Okay. All right. Good evening, everybody. This is Sean Groden, the Greene County Administrator. You are listening to or viewing a Zoom meeting of the Police Reform Committee of Greene County. I will somewhat apologize here. This Zoom meeting was kind of quickly organized as it was deemed that it would be inappropriate for us to continue to meet in person as our community continues to have a spike in the coronavirus and positives. So kind of at the last minute, we decided to do this live for the committee. Katie from MCAT has slated the speakers this evening. This video will be recorded and then placed on the county website and social media outlets for further review by the community. And from a programming standpoint, this was to be our first meeting of the month of December. However, at this time, I'm pretty sure we will not hold the second meeting, as I'm sure the county officials will be dealing with the spike in the positive levels as we get closer to the Christmas week. So we will then reconvene in January at a time and a place to be determined at that time. So I apologize for the short notice of this, but again, with the amount of positives increasing daily, it just seemed prudent to go long distance and not subject ourselves to a tight quarters meeting. With that, I will turn it over to Katie of MCAT. Katie, if you could then just introduce yourself and then your first speaker.
Sure, Beth, I was just sending Beth the link again. So I am Katie Olikowski. I'm the director of the Mobile Crisis Assessment Team that's operated through the Mental Health Association of Columbia and Greene Counties. This meeting today is to focus on substance use and various things surrounding that within our county. I've asked Veronica Salvis, who's the epidemiologist for the Columbia County Healing Communities Study, to kind of talk more about ODMAP. I know that I didn't cover all of the things that we could have covered in relation to addiction and recovery in this one meeting. And I think ODMAP is a really important piece of the data and what we kind of use to see what's happening. So I will let Veronica go right ahead.
All right, Veronica, you're on. Oh.
You're muted, Veronica.
Yep.
Thank you. You missed my thank yous. That was thank you, Katie, and thank you, Sean. I'm honored to be a part of this discussion tonight. So as Katie mentioned, I'm the epidemiologist with the Columbia County Healing Communities Study. For anybody who that is an unfamiliar term for.
Thank you. Thank you for the definition.
The Healing Communities Study is a NIDA-funded project. It's in 4 states. It's New York, Kentucky, Ohio, Massachusetts. In New York, it's 16 counties split into 2 waves. Greene County and Columbia County are both part of Wave 1. So as I said, I'm the epidemiologist working on the Columbia County Healing Communities Study. I'm going to share data with you tonight that looks at Greene County. In Columbia County, on our steering committee, we know that about a quarter, more than a quarter of our steering committee members work for service providers that serve both counties. So we routinely look at the data for both counties. So Katie has seen me present the Greene County data over for Columbia a bunch of times, and I think it makes perfect sense to present it to this group. So with that said, I'm gonna go ahead and share my screen. While this is open, it's hard to, I can only see a couple of the attendees. Assume we'll just hold questions unless there's something burning, Or absolutely, if you're looking at a data slide and you don't understand, ask. And don't hesitate to ask, because if there's something that you don't understand, it's probably not you. It probably just means that I didn't explain it well enough.
And Veronica, I have the chat open. So if anyone has questions, they can put them in the chat and I can let you know that they have a question.
That would be
And
great.
if you hit speaker view, you can see just the speaker that's presenting, and you can see the presentation much larger as well.
Thank you. Let me move this into full screen. Okay, thanks for the tip, Warren. That's a lot easier. All right, so we're gonna go through ODMAP data tonight. I compiled data looking both at 2019 and 2020. We're gonna talk a little bit about how it can be used for overdose prevention efforts, but I'm not gonna really get into that because most of the people who are expert in that are speaking after me. So a background on ODMAP data, and I have I've been working with ODMAP data probably for about 4 years. Before working in Columbia County, I worked in Dutchess County, and Dutchess County has been using ODMAP data as well. So ODMAP initially was implemented in what HIDA, so that's High Intensity Drug Trafficking Agencies, as a federal organization. HIDA deemed these HIDA eligible counties. Slowly all counties became eligible. So we're a HIDA county in green, therefore we use ODMAP. ODMAP is a real-time surveillance tool. Really, how it works is an overdose event takes place, and then it can either be that someone's on the scene, uses an app to enter the information from that overdose event right into a database that they access through their phone, or it can be that it's entered after the fact, either by somebody who's responsible for dispatch, or some communities have each individual first responder agency entering data. Some communities have it more centralized. Nonetheless, it's more or less spread throughout the county or throughout the country, so that ODMAP is the most widely available and most real-time access to overdose information that we have. That said, it's not perfect. It's far from perfect, but we can really think of it as a surveillance tool. The reason for that being it's real time, and that's the real benefit of having access to it. So like I said, the data is not perfect, but we can call it good enough data. So the data is not comprehensive. Not every overdose that happens is going to be entered into ODMAP. This is intuitive, and it's a matter of protocol. So it's intuitive when an overdose happens in the community, and it's reversed by somebody in the community. No first responder was there. It's not going to get entered into ODMAP. It could also be that the individual first responder agency does not participate in ODMAP. That also happens. So all of this is to say that the data we're going to look at tonight is, I usually describe it as what's been entered into ODMAP. So that is to say it's not everything. But again, it's a good look at what we do have available. It's not always timely. So this again varies, and it's going to vary in different communities based on procedures, protocols, and models really for how the information is being entered. So Columbia County and Greene County, I think, probably use ODMAP in different ways. Columbia County does rely on spike alerts, which are generated from the ODMAP system. Those spike alerts are based on a pre-determined cutoff, a daily count. So these are both small counties. Columbia and Greene often have no overdoses. So the cutoff might be 1. In some communities, it might be 2. In some communities, it might be 20. It depends on just what would be an aberration from the norm. For that to work, we need the overdoses to be entered in a timely way. This is a data, sorry, not a data. This is what we would just say is a typo, not a data entry error. Well, it is, it's a number. In Columbia County, 99% of overdoses are entered within 24 hours. In Greene County, my apologies, this is, I think, 53%. Not 535, 53% are made within 24 hours. So why does this really matter? I mean, it's a lot. You can use the analogy of administering naloxone, right? We know we have just a window of opportunity when we're talking about overdose. And if we are not timely in our response when we're administering naloxone, we know that that person is at risk of brain injury, that person is at risk of death. It's the same kind of thing when we're talking about data entry, honestly. If we figure out that we can use these spike alerts to respond in the community to prevent death, which it is possible. And I think myself and probably others on this call will talk more about that. Another consideration is just that outcomes are unlikely to be updated. So again, this is first responders entering. If somebody gets transported to the hospital, it's unlikely that somebody's going to go back in should that person die, after the fact, a few days later or a week later. So updates are not likely. And then substance types is entered into ODMAP. I generally don't use it because what that is just either self-report or someone on the scene reported that to law enforcement or the first responder, or that was entered, but it's often not reliable. All that said, I mentioned thinking about ODMAP data as good enough data, and it is good enough data. It's the only source of nationwide information that we've been able to look at in real time to evaluate what the impact of COVID has been on the opioid epidemic. So what we're looking at here is data that came out of HIDA across the country, looking at did COVID increase overdose rates? And the cutoff here is May because that was the time that they published this. But they had a post-stay-at-home period, so remember May, so long ago in May. But when we had, March was when COVID started, and then we had that very strong shutdown period. So they have a post-stay-at-home period. That actually means the shutdown. So amongst counties, this is as of May, who are using ODMAP, 62% nationwide reported that there'd been an increase in overdose after the shutdowns because of COVID. They looked at 30-day rolling averages and determined that overdose volume increased 18% during that period. And then I'm going to skip the next point. It gets a little bit technical, but the number of counties experiencing at least one spike alert per week increased by more than 20% during that time. And a trend towards clustering of overdose events in suburban and rural areas over urban areas has been noted during that same time. So that's it's something that we had been seeing coming out of CDC for a while, was data that showed that this is moving into rural communities, but now specifically again during COVID that there's clustering within the non-urban areas. And then so that's nationally. COVID has also increased risk locally. So we wanted to talk about just how we're able to use this data to respond locally. It's a surveillance tool. So we use a data-driven monitoring and response strategy. We look at monthly and weekly volumes and find trends within that to find periods of time that would indicate that there is risk beyond what's normal. And I'll talk more about what that means while showing you a little bit of your own local data. We're also able to look at municipality level trends. I've talked a little bit about spike alerts, so spike alerts. And then we, in Columbia County, were able to calculate fatality rates in two different ways. Both are somewhat approximate. Neither is a perfect source, but ODMAP alone can indicate whether an overdose was fatal or non-fatal when it happened. So if we divide the fatal by the non-fatal, you get a fatality rate. We can also divide the fatal overdoses that we know are happening because we use coroner data in Columbia County, and then use all the overdoses that are in ODMAP as our denominator and calculate an approximate fatality rate that way, which helps us keep track of whether or not our prevention efforts are successful. So overdose or not, are people surviving, right? Because that's what's going to happen when naloxone gets out into the community. Overdoses will still happen, but if the naloxone has got into the right spot, people are going to survive those overdoses. And then through a coordinated effort, we, as I mentioned, use data in these other areas. These are focus areas of the Healing Community Study that I mentioned here, which involve making sure that we're getting to the right communities. So if the data shows us, who, where, what, when, how, getting to the right communities to increase access to naloxone and make sure that people have access and can be linked to medication-assisted treatment if that is what they want. So this data slide shows you the monthly overdose volume from entries that have been made into ODMAP January through November of 2019 compared to January through November of 2020. And the light green bars are 2019, the dark green bars are 2020. The little numbers are the counts, obviously, and then these up above are your increases 2019 to 2020 month to month. And then all the way at the end, we've got a total. So for ODMAP entries in total, 2019, there were 46. 2020, through the end of November, there's been 106. So that is a 110% increase, or a 2.1-fold increase. You can see some of the higher ones here. This was the sort of jump that we experienced with the more stringent lockdown when everything was very new and shocking and people didn't know where to go. There was a 4-fold increase in overdoses April of 19 compared to April of 20. And then it's been kind of up and down since then. November did have a significant increase, but note that there were none in the month of November in 2019.
Veronica, I just also want to mention that, you know, in 2019, we really didn't have a lot of agencies reporting into ODMAP, which is also why I think some of the numbers are so different. The state police are really, I think, the only ones who did a lot of reporting into ODMAP while we were trying to work this out as a county. The state police, I think, were really the only ones that were consistently entering data into it.
Mm-hmm. Thank you for pointing that out, Katie. That's important. And so this looks, I know this is long and complicated because this is weekly volume. So this is really running top to bottom, January through the end of November, the counts per week. The reason I'm showing you this is because this is one of the ways that we can see past. When you look at the daily ones, you just see 0, 1, 0, 0, 0, 1. It doesn't look like you can identify trends. If you collapse that, right? So we saw if we collapse it and look at months, we can start to understand what's going on. We can also collapse it and look at weeks. So we have spikes here, we have spikes here, we have spikes here. If you look at the Columbia County data, it's similar. And that makes sense. These communities are neighboring one another. When we have spike alerts, for example, in either of these two counties, it's also not unusual to see them elsewhere in the capital region. So how do we use it? Using that kind of information. So we have a regular work group meeting in Columbia County that does review this data. And then there's been pre-existing to the Healing Community study a really high level of interagency coordination that works in both of these counties. And they have already had a process of using ODMAP data. The health department in Columbia County is responsible for sharing spike alerts. I know that Greene County has a similar process, that their health department also handles spike alerts. But then in Columbia and Greene, because Greener Pathways works in both, Greener Pathways employs a data-driven strategy to coordinate outreach efforts aimed at increasing access to naloxone and other life-saving harm reduction tools, including MAT. We've got, I think I have, my last slide shows you who our partners are on this strategy, but many other local partners, especially including, I want to name Katie specifically from MHA, because she really spearheads a lot of the data quality assurance efforts for our team, have also been involved in this process. So we are able to look at data both geographically, temporally, and look for any clustering or trends, combine that with information that we might be learning from peers or other stakeholders to know, for example, when we've got a new fentanyl analog in the community and we know that we need to respond quickly with outreach because that analog is going to kill people. And then, so the last piece here, again, just goes back to monitoring the work that we're doing. So we're able to look at fatality rates to determine whether or not we've been successful. So this is an example. I don't have this for Greene County because the way we do this in Columbia County is that we combine total overdose volume, I mentioned this, using ODMAP data. So that's all the overdoses that we are aware of. There may be more, but that's the most we're aware of. And then we take fatal overdose volume. The fatal overdose volume is drawn from the coroner's office data. The reason being ODMAP is, again, they're likely to only have counts of fatal if it was fatal on the scene at the time of the event. So we use the coroner divided by total, and that helps us to calculate a fatality rate. And then we can compare what the trends are looking like over time. So quarter to quarter, we can also compare year to year. And we can look at that both in terms of total overdose volume. So is there a change just in the number of people who are overdosing? And we can also look at changes in our fatality rate, which again helps us to understand, are we getting naloxone where it needs to go? Are our first responders successful in preventing overdose deaths? And then these blacked out spots are things that we won't be able to calculate until the end of the year. But that's basically how we're able to calculate those rates and monitor the work that we do. This, I believe, is the last slide that I have. Again, thinking of this just kind of as a case study. There is a Healing Community Study project in Greene County as well. This project does largely touch both. I highlighted in red 2 spots where we are specifically focusing on improving the quality of ODMAP data. And as I mentioned, this is Katie, these names are probably familiar to everyone, I'm guessing, on this call, but Katie Oldakowski, MHA, Carl Quinn is Greener Pathways, Danielle Hoteling is Twin County Recovery Services, and that's me. Working together, these are efforts aimed at, again, both counties. So including this simple presentation, just really stressing the value of this data and what we're able to do with it to prevent overdose death and to do some effective outreach in the community. I believe that is my last slide. I did pull up, I was curious myself, kind of what are we doing here tonight? So I did pull up information from Governor Cuomo's guidance documents related to this evening's event. And this is only a quote, which just stresses the urgency here. We have to address the tensions and lack of trust between our communities and law enforcement that serves them. I understand it's complicated. I understand it's difficult, but people are dying. I did open both of these things and reviewed them. And there's, the document itself is not aimed at substance use. It's about police reform in general, but there are a handful of recommendations and studies and places where they talk about the partnerships between law enforcement and behavioral health, public health, et cetera, in overdose prevention, and thinking about the role of police in responding to overdose events, or how the role of police should be modified, right? So the paradigm behind opioid epidemic has changed so much over the last decade. And as we continue to evaluate that, just making sure that we're using every bit of information that we can to do as much as we can to prevent as many deaths as possible. So that's it for me. I'm going to stop my share and turn it back over to Katie.
Does anyone have any questions about the presentation? I see Rabbi Zoe with her cat. I love it. So, and it's important, Sean.
I have one question. I forget what the three, MAT, M-A-T, what's M-A-T stand for?
Medication assisted treatment. So there's 3 different forms of medication assisted treatment. It's methadone is probably the one you're most familiar with. And then there's also Suboxone and Vivitrol.
Okay.
Mm-hmm.
Thank you.
Yeah, methadone is the familiar one. They're the gold standard right now during the overdose crisis. There's data out there that show, regardless of opinion of service provider or service recipient, that being on MAT reduces your overdose risk by 50%.
Thanks.
Mm-hmm. We have Richard.
Yes. My question is, has there been any times where an overdose case has been called and the police officers showed up and there was a complaint maybe from the person who was overdosing's family about the care that they received or anything of that nature?
I don't know if Veronica can necessarily answer that, but I think that there's some individuals from the sheriff's department who can also speak to that.
There are, yeah, so that wouldn't be in the data that I looked at. There are, I would say, just in that link that I shared at the very end, FYI, I threw up my screen because it looked like Sean might have accidentally shared his. Okay. There are sections in that guidance document that I shared the link to that do share suggestions for how to collect and how to aggregate and how to increase transparency and share data on things like complaints or anything else, including demographic information. But that's not in ODMAP. That's not something that I have.
So if a complaint came in about from a family member of someone who overdosed, who gets the complaint? Where does the complaint end up?
Does someone from the sheriff's department want to address that?
I know they're there. Adam, are you there?
Yeah, I'm here.
Did you hear the question?
I did. It's in regard to if there's any complaints from family members about police agencies at an overdose situation, correct?
Yes.
There's none to my knowledge, at least for the sheriff's office.
Okay, so there hasn't been any.
That's correct.
Okay, because there's a difference if there hasn't been any, or people don't know where to go if they have one. Correct?
Absolutely.
I would agree with that.
Okay,
Yeah,
thank you.
I had a little difficulty unmuting here for some reason. But we have not seen any complaints.
Sheriff, would you introduce yourself, please?
Oh, it's Pete Kosminski. I think I'm being displayed as the sheriff's vehicle there. Yeah, we have not received any complaints. There is a method to do that, but we can only address what we have. Our response is not the other police agencies in Grant County.
Okay, so if a family member had a complaint, who would they go to? And how are they aware to where to go? That's what I'm trying to find out, Sheriff. Would it be the Veronica's office?
They could make a complaint anywhere, any step along the way, whether it be to us directly or to their provider or to MHA or whoever ends up helping them, even when they get to wherever they're going. If they go to the hospital, there's multiple avenues they could take to make a complaint. But again, we have not seen any that since I've been there. So
okay.
All right,
Are there any other questions?
Katie, I'd ask you to move on. However, presenters, if you use acronyms or other terminology, please try to fill us in on the jargon, if you will. Sometimes we get lost, the non-professionals get lost there.
Sure. So next, I'm going to introduce Beth Schuster. She's the Executive Director for the Twin County Recovery Services Agency that covers both Greene and Columbia County.
Hi, glad to see so many people on this. It's a pretty important topic. So our agency has been around since the late 1970s, and we provide outpatient services to people with substance use disorder and alcohol problems. We have outpatient clinics in both counties We have a women and children's residence in Greene County, where we also take pregnant women, and they deliver at the hospital and come back and are in a safe environment to begin to raise their children. We have a men's residence in Columbia County, and both of these residential programs accept people from both counties. When we first opened many years ago, we thought we would be taking a lot of people from other counties in our residential programs, because people said, well, there just aren't enough people with alcohol and drug problems in Columbia and Greene County to fill up your beds. Well, there's more than enough. In fact, we've been trying for the last several years to relocate and expand. And that would also give us an opportunity to increase the number of beds for small children, preschool age children, to be with their moms while they're going through recovery process. Our outpatient clinics do assessments, individual and group counseling sessions, and our medical director, along with our nurse practitioner, also prescribes medication-assisted treatment. And as Veronica said, that is both Suboxone or buprenorphine and Vivitrol injections. We are looking to actually enter into prescribing Sublocade shortly, which is an injection for Suboxone instead of the regular dosage requirements that are under Suboxone now. It's a film that you place on your tongue, and et cetera, depending on the dosage. And we'll be curious to see how many people take that. So the nice thing about an injection is that when someone leaves your office, there's no way they can alter what they're doing. It's in their system. And so they can't not take the medication in order to get high. So that's why we like the Vivitrol and Sublocade. At any rate, we are extremely busy with our medication-assisted treatment program. Our nurse practitioner and our physician are both packed to the gills with clients who would like this. There are other places in the county where they can get these medications if they wish. Greene County Family Planning is one. And excuse me. And there are private physicians who will also do this. Usually when people enter into that process with us and they're addicted to opiates, we also provide other ancillary services, such as the counseling, life skills, et cetera, et cetera. You know, addiction to any of these substances requires more than just abstinence or a reduction in that use. It requires kind of a relearning in the way people live their lives. And that's one of the things that we do at Twin County Recovery Services. Many of them are alienated from families, from their community. Many of them don't have jobs, never pursued an education. We work hard to make sure that they also get involved with that instead of just taking medication. So that's our process with that. We also have a prevention program, which works in several schools in the community. During the time of COVID, we've been doing a lot of telehealth, both with our prevention programs in the schools and with our clinic. And that has worked out actually very well. The only issue with that is that, you know, we need to do drug screening, urine drug screening, not possible when you're just doing telehealth. So we do ask that people come in occasionally to get tested. One of the other programs we run is Greener Pathways, and Carl's going to talk a lot more about that tonight, but that has been such an advantage to our program and to the communities, because at the clinic, we are not really allowed to go out and meet people in the community and do our work. But the peers that work for Greener Pathways can go anywhere and meet anyone. And if they're willing, perhaps refer them to treatment or to some other program. Greener Pathways doesn't only refer to our own clinics. They refer to other clinics. If people don't want to come to us, They refer to other medication-assisted treatment providers if people don't want the rest of the counseling services. The point is we want to intervene before someone dies. And if that means they don't want to go to a formalized treatment program, that's okay. Obviously, we prefer they did, but if they don't, it's okay, as long as they're getting some kind of support and some kind of help toward a recovery program. I'm not sure what else you're looking for. I know that we work pretty closely with, I know the law enforcement whenever we can. We try to work closely with the district attorney's office and the public defender's office. We work with a lot of other agencies who provide referrals to us, and we communicate with them as best we can as to the progress of how someone's doing in a treatment program. We also do referrals to inpatient and detox as the, it's indicated by the severity of the problem with the patient that they present. So I'm, available for questions if I didn't cover enough, but I don't like to take up too much time. I know there are other presenters, so I'll leave you with that for now.
Thank you. Any questions for Beth?
Again, I'd ask the sheriff's personnel to jump in there on their involvement with Twin Counties and their history.
Sure.
Adam or Sheriff?
Sorry about that. I keep having to unmute and get moved around here. Yeah, we work extremely well with Twin Counties and MCAT. We've been attending every overdose, whether it be a small community meetings. We're actually trying to basically back on track to what our mission is. We are actually trying to interact with those communities individually through our partners, our stakeholders, in order to give them access to us directly and to show them that we are on their side. We are promoting that as much as we possibly can. And George, I think, is on the line here, and he could speak directly to his involvement with these agencies as he does go out on every overdose. George, are you on there?
I am. I don't know if you want to save that everything for my when I do my presentation, or.
Yeah, George, why don't you?
Okay, we do work daily with MCAT and Katie. We do presentations at the schools. We do attend all of their those quarterly. What are those called, Katie? The
coalition meetings.
The coalition, right? The coalition.
Right.
Yeah. We certainly try to put every resource we have into working on both assisting them, as well as we still have to deal with the criminal aspect of this. So we do also work on that. But yeah, George, when it's his turn, he can go into detail into what we do on a day-to-day basis in this venue.
Well, I'd like to add this, that we're absolutely thrilled that we have a sheriff now that supports us in what we do. The whole department, it's just a wonderful thing for Greene County, I have to tell you. It's a 180-degree turn from what it was. The other thing I just wanted to mention is that we were recently given the permission and the credentialing or certification or whatever you call it to be what's called an opiate overdose prevention program, which means we get to hand out Narcan to our clients, to their families, to anybody who walks in the front door. Our staff is all trained to be trainers. So we're another location that people can pick up Narcan if they need it.
I just want to jump in here as a public defender. Amanda, we've worked with Twin Counties for years and had a lot of success with them. I'm glad to hear about the new subrogation. I didn't know about that because I'm a big
The subrogate, yeah.
for
Right.
all for the reasons you mentioned. And I'm very happy to have what we've had right with our sheriff this year. He's done wonderfully to help us work with our clients. So I'm very proud of it. I think it's a step in the right direction for our county.
Yeah, totally agree.
So I
Go
just
ahead,
want to, I should have done this before. So like we did with the mental health meeting, this is to talk about briefly for the presenters, your agencies, how you currently work with the sheriff's department and how you can see further collaboration with them. And then it's kind of up to the sheriff's department to kind of to figure out if this fits, if it doesn't fit, if we as committee members can be educated and build this in as policy or changes to things too. So forgot my
Okay.
disclaimer.
Yeah, thank you, Katie, for zeroing back in on here. At the end of the day, the purpose of this committee is to review police operations, and certainly substance abuse issues as they deal with them on a daily basis is part of the community issue that we need to address. So thanks for the clarification on that.
Yeah.
And I would ask
And
the remaining.
in light
presenters
of that, Sean, I would just like to offer that, we have staff that are really good trainers. So if there's ever a topic that we can work with the sheriff's department, we'd be more than happy to.
Thanks, Beth.
Mr. Turpin, I saw your hand up.
Thank you. Beth,
Yes.
has there ever been a time a person shared with you that their rights was violated because of police interaction when they were, breaking the law by trying to get the drugs or taking the drugs? But being addicted is not a crime. Taking the drugs is a crime,
Right.
but addiction is not a crime. So has anyone shared with you, and I'm not asking you to identify the people who did,
Right.
or, for that, but if there's someone who came to you because you was there when they when they was at their lowest, and they shared with you that they felt their rights was violated, what's the procedure that you take that something came up against one of the sheriff department or the police department?
Okay. So the only time that we get complaints about any police department that I'm aware of are people who are arrested for driving while impaired or driving while under the influence. And they come to, we also operate and run the impaired drivers program. When people show up for that particular class and we allow them to talk about their incident, blah, blah, blah. Frequently we get, complaints, well, they shouldn't have pulled me over. Well, they shouldn't have done this. They shouldn't have done that. We can't make a judgment call on that. We don't know what happened. We weren't there. What we always ask them to do, though, is contact their attorney if they feel like their rights have been violated. Because that's their representative and that's the person who can look into this on a legal basis. We certainly can't do that. As far as other people in the community who get arrested for different things and drugs were involved, we don't hear a lot of complaints about that. By the time people get to us, it's usually one of those situations where they kind of acknowledge that, well, yeah, I was. I did, and whatever, And we always like to recommend, and we work closely with drug court and the PD's office, and we like to recommend that perhaps if someone enters drug court or if someone does something else, there's an alternative to incarceration, that be considered depending on the nature of the crime.
Okay, thank you. But I want to be sure I heard you right. Because yes, I do understand if someone's intoxicated, it's why'd you pull me over? There's a problem with that. No, the officer has the right to do that if they see something's not going on. But I'm talking about it after they were arrested. Was their rights violated? Was they shoved down or thrown in the back of the car? Or has anyone shared with you that? And you said if they did, if there was a complaint, you would tell them to call their lawyer.
Yeah, I would.
Okay.
But again, we don't hear much of that. We,
Okay.
if any.
Okay, I'm just asking if there's a
No.
procedure. That's
Yeah,
what we're
that's
here.
fine, because,
We're
you
here
know,
to find out if,
no, I get it. And that's a great question, actually. And, you know, I would be the first one if I thought someone was mistreated to say, you know, you need to talk to somebody about this. But we really are not hearing that.
thank you, Beth.
I would tell you.
No, come tell me.
Thank you,
So,
Beth.
I don't think were any other questions? All right, so Laura Churchill was initially unable to make it today, and I'm really glad she could. She is going to be speaking to us from family planning about their MAT.
Hi, everybody. So my name is Laura Churchill. I'm a nurse practitioner, and I'm the Deputy Director of Public Health here at Greene County. And I serve as the director of the Family Planning Program, which has been around for over 48 years. We see about 1,200 unduplicated clients every year. We have a range of services: family planning, contraception, helping people plan and promote positive pregnancies. We do cancer screenings, STD, HIV, hepatitis C, evaluation and treatment. We offer a sliding fee scale, and we see folks that are uninsured and underinsured. So we do a lot of preventive services. We started doing depression screening several years ago, so we have a really great relationship with MCAT. Thank you. And that's actually one example of where I would say that we've used less law enforcement, because when people would come in and they were sort of maybe not taking their medication anymore, maybe they didn't seem safe, there was some issues. Unfortunately, we had to call 911 and the sheriffs would come, and that never did. And so we've been so grateful to have mobile crisis that can come on site, do an evaluation, you know, figure out that the person's really not needing to go to the ER, and law enforcement completely stays out of the picture, which is great for those people that are suffering from what they're suffering from. In 2018, we got a state grant from the Department of Health to increase the services for people in the community, especially for those using opioids. At the same time, we were noticing a lot of our patients were struggling to get into treatment or stay in treatment for people with opioid use disorder. A lot of our patients were telling us they were injecting heroin, trying to buy Suboxone on the street. So we started a low threshold buprenorphine access program modeled on the one that Project SafePoint does in Albany. We did some training with that. And so we're relatively new to this field, and we see ourselves as a bridge program. Initially, that's how we got started, was to try and help people get them engaged in some form of care. We work very closely with Greener Pathways and Twin Counties and mental health and MCAT. We try and be an agency that helps people figure out where they're landing and get on for more and more treatment so that they can do well and go on to lead productive lives. We do offer the Sublocade injection, Vivitrol injection. We do a lot to prevent, we do a lot to help our clients understand about law enforcement interactions when they are carrying their medication with them and it's unlabeled. If they get stopped by law enforcement, we tell them that it will be confiscated. If it's not in a labeled container, they need to leave the house with it in a container with their name on it. Otherwise, if it gets stolen or confiscated, we cannot replace it. We do urine drug screenings to try and identify people that may be not taking their medication the way it's been prescribed. We see a lot of hepatitis C. As a public health clinic, we can offer rapid hepatitis C testing and screening. And that's been one thing that we've seen. Fully 1/3 of our clients who inject drugs have hepatitis C. And that's a real problem for our community. Other services, essentially, we are here to help people who are most at need enter the system of care and help them figure out where they need to go next. We have recently begun a great partnership over the summer with Greene County Mental Health to try and identify people that really need mental health treatment. So to come into our program and start MAT is not a requirement to do anything else. And some patients aren't able to do other things. They work, they go to school, and they're doing just fine on medication. some of them do not do well and they need a higher level of care. And we do work with them extensively to try to move them on and up. And so our mental health collaboration, which began this summer, has been very exciting because we're moving those patients into mental health care, trying to make that like warm handoff so that we know that they're going to land. And now they're going to be providing medication assisted treatment as well. Just two things I want to say about the injectable forms. They are good in that they can reduce diversion, but in order for someone to do well on Sublocade, they need about a 12 milligram daily dose of Suboxone. And some patients who take higher doses than that find that they don't do well on the injection. And Vivitrol is also a great drug and we use it to treat people, but they have to have been not using any opioids for at least 7 to 14 days. And a lot of times they can't get that far. So it's hard to get them initially started. People do better on Vivitrol when they've been incarcerated or they've been in a facility where they've been able to be monitored more closely. We do also do telehealth. We have been doing telehealth since March and it's been very successful. We do see a higher number of minorities and low income people in our community than I think we all do, but we certainly, by offering a sliding fee scale, those are some of our most vulnerable citizens. One other area where I want to just point out in terms of law enforcement is that we do have people that have been victims of rape, and we have called law enforcement to come and talk to them, but it's hard. They don't often want to talk to law enforcement. So we do try and help them connect with the REACH Center through the MHA and go to the hospital, have the rape kit done, and try and get them to find the way to trust and discuss that rape. But many rape victims never, ever go for the rape kit, and they certainly don't speak to law enforcement. And one other area of law enforcement that I will point out is our undocumented citizens. Our clinic receives money to see people that aren't undocumented. And so it's always an area of concern of mine as they go through the sheriffs, they go past law enforcement. You know, folks have the right to access these services and not be stopped for their immigration status. So that's another thing I just want to shout out as we're covering all the law enforcement intersections with the work that I do. I think that's all I have. If you guys have questions, please let me know.
Any questions? Okay. Next is Jason Friedenberg, Director. Thank you, Laura. I have to say thank you. I'm really glad you got to jump on. Jason Friedenberg, he is the Director of Greene County Mental Health Clinic in our DCS, and they have just launched an MAT program at the Mental Health Clinic.
Thank you, Katie. Yes, so I spoke at the last meeting, so you heard about the details of most of the services that we offer, but the one that I didn't get to talk about is our newest service, which is offering MAT, medication assisted treatment, now in the county as well. And you know, naturally, as you've seen, we've been aware of the opiate epidemic in Greene County and how it's affected the community. And we knew that this was something that was needed. It took us a while to be able to make this happen. One of the things that helped, there are two things that helped finally get this going last month. One is, I think, the collaboration, the relationship with family planning that started over the summer, as Laura just described, to have that warm handoff of engaging clients and helping to keep them engaged across the different departments. And then the other thing was the Healing Community study that we talked about at the beginning, that Veronica is part of in Columbia County. One of the goals of the Healing Community study is to also increase MAT services in the community as well. So that was one of the things that also helped move this along. So we were able to. We now have two prescribers. We have a nurse practitioner and our medical director are both waivered and licensed now to be able to prescribe MAT. At this point, only our nurse practitioner is doing that. Our medical director is doing it as sort of a backup and sort of as a supervisor to some extent. But it might be something that he might move into in the future. But we do have a nurse practitioner that has also been working with and collaborating with and kind of shadowing at at Public Health at Family Planning a little bit. And we just started to take some new clients with for MAT just in the last couple of weeks. I think we're up to 4. And you know, we're eager to do that because we see the need. We're also doing it because not only to expand it in general in the county, but we're also hoping to hit a little bit of a different pocket of the population, because there are times when people are only willing to go to one agency and not into another. You know, Laura sees people at Family Planning that maybe it's hard for her to get to Greene County Mental Health, and vice versa. And also we have clients that are sometimes engaged in our services and are receiving MAT somewhere else. And it's often best to have, you know, as most people want to, when they can, receive all their treatment under one roof as well. So there's a couple different advantages for us to do that. So we're eager to see how that progresses. The other thing I'll mention too, I don't want to talk too long since I spent a while talking last week about our services, but I do want to mention that Beth Schuster said that Twin Counties has recently become an opioid overdose prevention program, where they're able to distribute Narcan, naloxone, and to train people. And Greene County Mental Health also recently became that as well. It was one of the initiatives by New York State Office of Mental Health, who licenses us. One of their initiatives was to become an opioid overdose prevention program, also to begin offering MAT. So these are all part of the larger picture coming down from the state of different ways, different initiatives to help us address this epidemic. Any questions?
All right, thank you, Jason. Kai Hillman, Director, Youth Clubhouse.
Hello, everyone. Thank you, everyone, for sharing so far, and the people that after me. Everyone is always so inspiring to me. My name is Kai Hillman. I'm the Director of the Youth Clubhouses in Columbia and Greene County under the Mental Health Association of Columbia and Greene Counties. So we've been in operation since 2017. We serve youth ages 12 through 18, and then young adults 18 and up, let's say. I don't really turn people away, to be honest. So what are we? We're a recovery community organization for youth. We are a drop-in center. You know, our aim is for young people in recovery, but we tend to be, for the youth, preventative, and for the young adults, more of a recovery community. Like I said, the youth program, the 12 through 18 drop-in hours are, you know, prevention in many, many ways. There's so many intersections of the youth that we see, whether they're mostly affected by parents that have substance use disorders or have had in the past. So a lot of the kids we see are affected by parents, aunts, uncles, you know, family members, brothers, sisters with substance use disorder. So we support and empower these young people. We see a lot of young people of the LGBTQ community. We see a lot of racial differences, and really valuing and like implementing anything like to support their process in growing, whether it be employment or education or even just recreation, you know, healthy recreation without alcohol and substances. So there's many things that we do. It's hard to explain what we do, but you know, we do it. We serve, I guess, all in all, we're providing recovery supports. Peer support is kind of like the main theme, whether it be youth, young adults, staff. I'm in recovery myself. As a director, we like to hire people in recovery. We also define recovery differently in a way. Yes, substance use disorder, but also trauma, racial disparities, like anything that someone brings to the table, mental health, they're bringing all of that to our table. And, we're supporting them and connecting them with people that would support them and just creating a very supportive culture within the clubhouse. For our young adults, last year was our first year serving young adults, 2019, and I had 2 certified peer recovery advocate roles serving the young adults. And they worked with people in groups and individually, providing transportation to court, providing transportation to mutual aid meetings. We also are a space for mutual aid meetings to happen, with many collaborations with people on this meeting. And outside of this meeting, we were able to start refuge recovery meetings. We started harm reduction meetings, which feedback and attendance, you see how important those were. We support any pathway to recovery. It's not just, you end up in arrested court and, having to do treatment. It's like, that works for some people. And then we also want to some people don't want to do mutual aid meetings or AA or NA. So we try to provide anything different, anything that would work. We're not treatment. We're just a support and a connection. We support treatment, but it's not for everybody. And what else do we do? Yeah. Mainly also trying, Columbia and Greene County, many upstate New York counties has big battle with the stigmas that substance use disorder brings within people's own families, within the community. So we're just constantly trying to educate and break those stigmas. For this call, for instance, we're on with the sheriffs and we're talking about police reform. I'm thinking about people with substance use disorder and, police interaction. We all know that there's a lack of trust between communities, for the history of, if you get arrested and incarcerated for an addiction per se. I think someone else had said that earlier. And, that's a reality. So how do we build the trust between law enforcement and in a recovering community? There's been plenty of times where I've used the local police department, not the sheriffs, but the local Catskill PD or whatever. And I have staff and youth freak out. No, don't call the police. But I'm using them in a positive way, because in my past I've had a positive experience, but I am, for negative, I was definitely arrested in my younger age and all that, but somehow turned it around and was lucky enough to have positive experiences with law enforcement. That doesn't always happen, and I understand that. But how can we create more of that relationship is what I'd like to see, more of that positive relationship, and a trusting relationship. So that's huge. Reducing the stigmas within and educating law enforcement within their own community, because I know that's probably tough as well. You have some officers and some representatives that are totally on board and understanding reducing harm and treating people where they're at and not just in a punitive way or anything like that. But yeah, we got to figure that out. I like what Mr. Turpin was bringing up earlier, that had me thinking of transparency and accountability. How are people held accountable? It became clear to me that there's really no written procedures that we know of. If there is a complaint, and I'm not saying we want just having complaints just thrown all over the place. But what is the real procedure to just hold each other accountable? Like, I would want to be held accountable. Like, I would want to know if something's going on within my program, like what is, if my staff treated someone, there's a procedure for that, and just making it known, I guess, if there's any procedures that we could recommend or follow, if there is anything. And hopefully there is nothing, but it's just nice. It's a security to know that it's out there, and a reality that things happen, and how do we learn from it and grow from it? So, yeah, I don't.
Hi, do you have any suggestions on how to build that trust within that community?
Yeah, I think positive interaction for one, having law enforcement come and build a relationship with our young people, number one, so that, when they see young people in the community, they might know them by name, and they might say, oh, I had this positive experience with officer such and such, he's cool. Like he's looking out for me,
Hi, this is Sean Groden. Do you have any scheduled outreach or interaction with any of the agencies now on a regular basis?
No, we have not. No. Usually law enforcement will come because our alarm goes off. But but in those, even in those interactions, the police come in, they, focus, they could linger a little and say, hey, how you doing? I'm so-and-so,
Right.
Even that would be excellent.
Well, I see it analogous to our school SROs. They're not there to be law enforcement per se. They're there to be an ombudsman, or they're there to be a facilitator of communication. And I'll tip this over to the sheriff later as to whether or not your center or any of your peer centers, that we could organize some kind of a drop-in, so that the first experience is not from a 911 call or an emergency call, but it's a handshake first.
Yeah, and I agree and support that. And then I also, just being, have this fear of like, are my kids going to get labeled because they were seen at the clubhouse? Now I got to say, like, any kid that drops in, we're not asking them if they're in recovery or, anything like that. But, from an outsider, knowing the clubhouse is technically for young people in recovery, are they going to be labeled and treated in a different way? I fear that. And I just would want to make it clear to everyone, like, that's not the case.
Sheriff or Adam, do you want to respond to that?
All right. I think I got myself off of mute that time. Yeah, I don't think, Kai, I think you have the only one in the village of Catskill, correct? You don't have any elsewhere in Greene County, right?
Correct.
Yeah. I've met you before at the community meeting in Catskill, and I do personally attend the drug court. We also go to the drug court graduations. And I certainly believe in making these relationships. We certainly try. I go to all the victim impact panels. I speak at most of them. And I think Joe is on the line as well somewhere, Stanzioni. And I think he does that same outreach that we do, trying to say that, not only are we here to enforce the law, but we're also here to help. And we're hoping that these are our community members, and we're hoping that they recover, get back on the right track, and we can all work together to that end. So I understand the premise of it. I just, we're looking for a fault in this small community, relatively speaking, where I think I have a relationship with every attorney in Greene County, and I don't think there's one of them that's going to let something go where some client told them, that we mistreated or mishandled somebody without us finding out. I mean, I have an open communication with Angelo. I believe he's on the line as well. And, he's got no problem telling me when we did something that might not be right. But so far, there's been no allegations from any of them of any mistreatment. But I do agree, Kai, if we could come to some kind of and we do participate in some of these things elsewhere. So it's kind of hard to get us in that. And I don't know if the stigma that you're referring to would necessarily mean those cops are there to, if they're coming into that meeting, if they're coming there to talk to people, they're certainly not going to label them, because we understand that they're there for help. They're not there for intentions of doing anything wrong. So, maybe there's a way we could do some kind of further outreach to that. And I'll certainly, if Davey will let us in the village, I'm in.
Cool. Thank you, Mr. Kaminsky. Sure.
Mr.
Hey,
Turpin?
Sean.
Yes, I wanted to know what.
Who's asking me a question?
This was Adam.
Go ahead, Adam.
I would just want to say that one thing that I've gathered from several of these meetings, we do, just like the sheriff said, a lot of outreach. There's only so many of us, and there's only so much outreach we could really do in terms of personnel wise. I think part of the solution to reduce that fear, that anxiety about police is going to have to be put back on, the people that are sowing the seeds of discourse that really have no personal experience or interaction that they can point to that's negative need to be called out when you see them. So if they're attempting to kind of utilize that for some sort of control or whatever their intentions are, those people need to be called out and say, hey, okay, if you have a problem with the police, what was your problem? If you're just saying it to stir discourse, then you're wrong. So, the public needs to police themselves in that respect too, as opposed to just repeating what they see on Facebook or on TV. Is, if you had a real experience, fine, we'll sit there. We're willing to, just stand there and answer if something was wrong. But if it's just in a general sense to just sow this discourse, that needs to be called out too.
Sure. And I just want to add to that is a lot of things could be perception, anybody's perception in the climate, especially this year, as things come out, whether it's happening within our community or not, there's still a fear, because that is very true and valid, especially for young people of color, feeling, I'm white and I was feeling it, you know what I mean? Like the overwhelming sense of everything that was going on, I can't even explain, but I think, being sensitive to that and recognizing smaller microaggressions and things like that, and getting the police force, and everyone, it's not just, and I'm not picking on the police force, but that's the point of this meeting, but everyone needs to, I would like to see everyone getting educated and really, yes, calling each other out, but recognizing our own privileges and things like that as my experience is different than, someone else's, and we can't invalidate that. So, I don't know. Yeah. I'm sorry. I'm not the best public speaker or anything like that. But
I was pleased to hear from you that your experiences with police are positive. So, to hear that you still have a mistrust, that coming from the police side is, well, what else can we do? If you have positive experiences and you still mistrust, what's the solution to that?
Right. Yeah, I'm willing to, put our heads together to figure that out. I don't think there's any easy solution. I think it really comes down to relationships and, building, and it takes time. Okay.
Reverend Turpin, you were going to ask a question there before?
Yes, thank you, Sean. I just want to know, can you tell us the address of the clubhouse? Is that possible, or is that a private matter?
No, it's not private at all, because again, we're not treatment, and anyone can walk in and participate. You don't have to have a substance use disorder or anything like that. So the address is 455 Main Street in Catskill.
So you're actually the clubhouse that's right across the street from the church.
Yes, sir.
Yes, right by the parking lot.
Right. I didn't know that it was an outreach and that for drug abuse or alcohol. I didn't know that. I knew it was a clubhouse,
Right.
but for young people, but I didn't know that, you offered that service.
Yes, sir.
So thank you for sharing that. And the other thing I just wanted to mention, I keep hearing that there's a trust factor in the community, but there's no complaints. So to the undersheriff, I don't get it either. There's a problem with trust, but there's no complaints. I'm trying to, Sheriff Pete, I'm trying to find out, I'm trying to juggle that and see, where does it go? I mean, how come there's a trust factor? I mean, a trust problem, but there's no complaints.
Well, I think
if you have no complaints, why is there a trust factor?
Well, I think it's because people bring with them their experiences, and they share those experiences, though they may not necessarily be coming from anybody in Greene County. You go right up to Albany, and there could be, I'm sure there's a myriad of problems they have that we don't. Those people move here, they go to school. Some of them, the school districts overlap. They talk to their friends and they hear, and some of those stories may be true, though they may not be coming from our own police community. Not that we're all perfect. We all have room for improvement, but I think a lot of those, you drive across the bridge to Hudson, and you're going to have a different interaction with the police over there. It's a different, it's not that far. It's close enough where it makes an impact on the people that we serve. And
okay.
I think we also see things nationally.
Right. Correct.
You watch the evening news, and you see typically the evening news likes train wrecks. They don't like puppies. So I think we have a tendency to see the bad all the time. But we'll get to that in a minute when George gets on too.
Okay.
I would just like to add, one of the things that our patients tell us is that there's an unequal distribution of power. So as soon as somebody has a uniform and a gun, that automatically changes their perception of the power distribution. So there's, no matter how much we want to look at law enforcement positively, that initial gut reaction that some of our patients have, why they won't disclose a rape, why they won't, look for help, is that there's this power gradient that is just absolutely there, and we can't walk away from that. We can't pretend that that's not true.
And I have a question. That was a good point. And so the sheriffs are only on this call, but what about the other police agencies in the county? Forgive my ignorance, but are there other meetings that?
Yes, each of these 7 other law enforcement agencies have to go through this same exercise on their own. We did bring in the other agencies at one of our first public hearings, just to introduce the fact that there are 7 other, well, actually there are 8, because the state police is being the 8th, but the state police does not have to go through this same program. But the other agencies, they can't join us. They are responsible to do their own review because they have a law enforcement agency in their community.
Okay. So yeah, I just want to make that discrepancy too. So, some of the stories could also be very individualized to other police agencies within the county.
Which we've heard.
Yeah.
And Veronica, I know you've been trying to ask a question too.
Sorry. I just wanted to also echo what Laura was saying. From my own experience, I don't live in Greene County or Columbia County, but in my community, I actually had a complaint based on an experience that I had with law enforcement in the city that I live in. Where do you take that? And that's what I keep hearing in this call, is there haven't been any, but also that maybe there's not transparent or easy protocols for people to follow. And I'm just thinking, as a data person, having reviewed this guidance document from the governor's office, there's a lot in there about transparency. And a big piece of that would probably be, a transparent process for collecting complaints and reviewing them in a way that doesn't leave people feeling so powerless, because that is what stopped me from making a complaint. I didn't make a complaint. I felt powerless. But if that transparent, objective process exists, right, and we're not necessarily reflecting complaints verbatim, but we're counting, it's data, it's a part of our process to improve the work that we do in the community. I think that there can be a little bit more flexibility around, the added work of actually saying we want to hear from the community, review that and improve and grow with the community, which I think is what this is about.
Yeah, I would like to add something too. This is not about Greene County Sheriff's, but it's about another police department in Greene County that people have had difficulty with, but they are so afraid of retribution to say anything because the community is small and things happen and nobody knows how or who or why, but that's what gives people fear to open their mouths and say something, because they're very much afraid that something else is going to come back on them. And again, this was not the sheriff's department from which I heard this, but that's a reality. I mean, that this happens in communities, and it's absolutely not all police. It's probably a very few of them. I mean, in order to be that perhaps aggressive or inappropriate in the first place, that kind of sets the standard for you better not say anything. So, I mean, that's a reality. We all, some of the, law and order or whatever. I mean, you can see this stuff happen and it's not the norm. I don't think it's the norm. I see police as, great aides. They have certainly helped me out in my life in many situations. However, there are always a few that will take advantage of the fact that they do have the badge and the gun. So.
If I could just throw in one more thing, it's also, the population that we're talking about, we often have encounters while people are in a moment of crisis, right? Katie could speak to this better than I can, but this is really about having people who are skilled and qualified at de-escalation. So it's not even bad apples. It is, there's a recognition from the behavioral health community that this is a challenging ask from law enforcement. And it's going to be a two-way street of training and being open to training and flexibility around how to work with us, allow the expertise of behavioral health professionals, and then the placement of law enforcement within the community to help move both pieces forward. And it's a difficult situation for sure.
Absolutely. So I'm just gonna start moving because we do have we're in a time crunch. Carl Quinn, Director of Greener Pathways.
Good evening, everyone. Thank you for inviting me to participate in this forum. My name is Carl Quinn. I'm the Program Director of the Greener Pathways Mobile Outreach Program, which is the mobile outreach arm of the community services part for Twin County Recovery Services. So Greener Pathways was created in 2017 in Greene County based on statistics from the state that identified Greene County as having one of the highest number of overdose incidences in the state. With that came funding from the state of New York through OASIS to create what's called a COTI program, COTI, which stands for Center of Treatment Innovation. So that was a way to get people in the community, to connect with people, meet them where they're at, find out what kinds of things they wanted to do for their treatment and recovery that didn't necessarily involve having to go to a traditional clinic format. So that has worked out well. It gives us the opportunity really to be boots on the ground We have a 17-foot mobile RV unit that we're able to take out in the community, meet people out there, try and do outreach and connect with people. And so that was where we initially started with a lot of what we did. In April of 2018, Columbia County was added because they were also high on the number of overdoses occurring around the state. So a lot of what we do is typically to meet people in the community and say, what do you want to do for your recovery today and how can we help? We're not forcing people to do anything. But we've been able to create some really good community partnerships in what we do. We use that mobile RV unit specifically to target where we know overdoses are occurring, where there may be people who are trying to connect to services who lack transportation because of the rural nature of the counties that we're both in. And so that has worked out through ODMAP when we're able to identify where a spike occurs. If we know there were 3 overdoses in Cairo over the last 2 days, we're gonna take that mobile unit and we're gonna put it out in the community and do outreach. And that was initially how our contact came to be with both Adam and with Sheriff Kosminski early on, right after their election, as one of their stepping stones to try and create some of this community network. Both Adam and Sheriff Kosminski came out to the RV, asked us a lot of questions about what we were doing, how could we work together. And that really was the start of a good partnership that we've had with the Sheriff's Office since that point. We talked at length about the stigma that sometimes goes along with the RV being out in the community. There was a community in Greene County where we had a lot of stigma around the RV being out there. And, I think both Adam and the sheriff were able to help us dispel some of what actually happens in the RV after being able to see it. Since that time, we worked very closely with now Investigator Tortorellis on the Impacted Citizens Program, both with Sheriff Kosminski and Lieutenant Quinn on, how can we work better together to serve the community that we're trying to impact. So it's an evolving partnership. We meet at least once a month, along with Katie from Mobile Crisis to address what's happening in the community and how we can connect with the people that we serve. Part of our outreach also involves trying to make sure that the people that we're interacting with typically have some type of justice impacted reason for wanting to be with us, whether that's through the public defender's office or probation or parole. So we've also tried to establish those connections with the Greene County community. We've done a Narcan training at the Greene County Public Defender's Office for all of the Greene County Public Defender staff. We've done some outreach with parole, probation. I actually just shared a story the other day of meeting a client who was at the motel in Cooksaki. And while our 2 peer advocates were there meeting with that client, trying to get them to go to treatment, the probation officer happened to knock on the door and say, I'm here from probation. And we were able to work with the probation officer to say, this person's ready to go to treatment. Let's let that happen and then look down the road at what that looks like. So there are some barriers that we're starting to break down with some of the law enforcement and some of the interactions that are happening. Sheriff Kosminski and I have had several conversations about what referrals to greener pathways might look like, how to connect people that they come across in the community who might benefit from our services. I think that's one thing that we'd like to continue focusing on to further that partnership along. I think there's some more work that we could do there. The other thing, speaking about distrust and the things that we've seen, we work with a lot of people who are post-overdose after it has occurred. We're still seeing people who are hesitant and afraid to call 911, and they're afraid they're going to get in trouble after an overdose. So I think that's an opportunity for us to work on reducing the stigma around people being in trouble after an overdose, and certainly trying to reiterate the protections that go along with the 911 Good Samaritan law. I think enough people don't understand that there is protection out there for them when they want to ask for help. And so I think that's a further thing that we can do. And I look forward to any suggestions or conversations that the group wants to have. Our population that we're all working with is ever evolving. There are problems we run in today that we may have never heard of in the 3 years of our program. And so we do the outreach to try and figure out what the best way is to do that. And like I said, a lot of times there is a justice impacted portion to that, but people have been really good in the law enforcement community on both sides of the river to try and help us develop what that looks like to have the best service we can for the clients. I think part of what gets out in the community is everybody enforcement is about punishment, and that may very well be true with some, but I think we're starting to see the shift that law enforcement is realizing that this is about people who are sick, who need help. So punishment certainly goes along with some of what they've done, but you can't address the punishment until you start people on a path to being well and healthy. And that's what I think we're looking to continue on the collaborations that we're working with. And I'll answer any questions anybody has.
Any questions? Oh, you're not unmuted. There you go.
Carl, my question really is more in a personal note. I would like to contact you in a further conversation. And how could I contact you?
Sure, I will message you my contact information in the chat, Mr. Turpin.
Thank you, sir.
You're welcome.
Any other questions? Okay. Investigator George Tortorellis with the Greene County Sheriff's Office Impacted Citizens Program.
Hey, good evening, everybody. Again, my name is George Tortorellis. I'm an investigator with the Greene County Sheriff's Office, currently assigned to working the Impacted Citizens Program, known as ICP. I'm glad to see a group here that is committed to helping law enforcement in our mission of building better relationships with the community. We're in the process of doing that. We've been doing that for the last several years. One of the programs that we have, as everybody knows, is the school resource officers. They are reaching hundreds of children on a daily basis, building great relationships, building trust, and that has come back to us tenfold already from what we've seen. My particular function in the ICP, or Impacted Citizens Program, is going out and assisting people that have overdosed. So I'll give you a little history. We first looked into the LEAD program, which is Law Enforcement Assisted Diversion. And we had a presentation done for us by Schoharie County, who's been doing that program for several years now. However, that program requires a lot of MOUs with all the county agencies and other agencies. And when we initially received that presentation, COVID just began. So that kind of put everything on hold. So in meetings we had with Sheriff Kuzminski, Under Sheriff Brainerd, Captain Quinn, and Katie from Mobile Crisis, and Carl Quinn, we came up with this program called Impacted Citizens Program. What that program does is we review, or our team, myself and another officer, sometimes a third officer, reviews 911 calls that were overdose calls. And the reason we review them, because not all overdose calls are typical overdoses. Some may be something that happened in a nursing home and it comes out as an overdose. A child may have ingested something that they accidentally took, which is an overdose. So we check into these, and if there is an overdose, the person was not transported to a medical facility and obviously was not a fatality, within 24 to 48 and sometimes 72 hours later, we respond, myself and sometimes another officer responds to the place of the victim. So the location of the overdose is not always obviously where the victim resides. So we visit the victim. we introduce ourselves. We're dressed typically in non-law enforcement attire, maybe wearing a sweatshirt like you see I'm wearing with the Sheriff's Department logo on it, or a hooded sweatshirt. We present ourselves in a non-threatening manner, and they open up to us pretty well. We offer them assistance. We tell them we understand they had an issue recently, and we have a program that could help them. So after they get all over the initial shock that law enforcement is actually there to help them, they are very cooperative with us. I ask them what their needs are. We build a dialogue, we build a rapport, we build trust with these people, and all this occurs within a matter of 5 to 10 minutes. Put it this way, so far I have approximately 35 interactions with individuals and have not one negative result from any of those interactions. Everybody has been either signed on to the program, or reasons have not signed on to any programs is because they're reconnecting with a program they were in prior to our intervention. So what we have them do is I have a form that I fill out with their name and information, and we ask them what kind of services they require or would like. And some of the choices are outpatient substance abuse disorder treatment, inpatient detox, inpatient rehab, mental health, peer services. We have a column for unsure or other. Some people just want to talk to somebody. So once I receive that information and their permission, I forward the information to Mobile Crisis, to Katie or Gabby, and they take over from there. They contact the individuals and they offer the services that the person requests. And many times it may even be unrelated services. It could be they're having problems with transportation to appointments. They're having problems with medical insurance to get help. So there's a myriad of problems that people run into that they are assisted with. We have about a 90% success rate in signing people up that we make contact with. And the reason it's only 90% is because many times, again, the people are already associated with some program that they kind of fell away from or dropped out of. And some of the other problems we run into is sometimes people, we just can't contact them. They're transient, or they're here on vacation and had an overdose and they're now gone, or they're simply going to look for services elsewhere where they live. So everybody has been receptive to this. The follow-up from when I check with Katie or Gabby on the people that we have signed up, people are sticking with the programs that they've been introduced to. And I feel like this alone is building such a rapport with law enforcement of the interactions that I have had and some of the officers has had that have gone on calls with me, that I think it shows a lot of caring for the community. Some of the, in preparation for this assignment, I took a class, Science and Addiction Recovery, that Katie had helped get us into. Some of the other qualifications I have in getting into this are my many years of law enforcement experience, communication skills with people, having empathy and understanding of substance abuse. Previously, I was a DARE instructor as well years ago. So I am familiar with building rapport with people and building trust within communities. And again, I know that I understand that's important, and I feel that we're heading in the right direction. Things are getting much more positive in the law enforcement end. And let's face it, there's always going to be a little bit of stigma no matter what happens, because people have a general distrust for authority in general. So once they see past the uniform, past the police officer, and they see the person talking to them, people change their perception. And they may not change their perception totally for all law enforcement, but they may change it for that individual at least. And I think that's putting us on the right road for building trust in the communities. I didn't take this assignment on merely just to take an assignment on. I wasn't mandated to take this assignment on by the sheriff or anybody else. I took it on because I do feel that there's a need for this. we're all tired of seeing the death and destruction that drugs are causing in our communities, and also the associated crime that drugs do present. If we address a lot of these problems, I think we're never going to be 100%. We're never going to be perfect, but we're going to strive for perfection. So that's pretty much my presentation on that. And as far as I know, the Reverend Turpin had some questions regarding complaints on law enforcement. While there's no formal processes, if there is a complaint, people many times will call the dispatch center and say, listen, I had a negative interaction with an officer, and that would be forwarded up the line to the supervisor on duty, who generally would forward it up the line to management or the sheriff himself, and depending on the respective law enforcement agency, their chief or whoever, and it would go that way. So while there is no particularly formal way to do that, that's how I've seen the process occur over the years. And many times they do approach an officer that they do know or do trust and would relay if they did have an issue that way as well.
So I just want to add to the data piece of this is really important because when we had initially gone to the Sheriff's Department, there was a group of us that we had talked with Public Health, Greener Pathways. We were trying to figure out how to get the information about overdoses because ODMAP data doesn't really give you specifics on anything. So we as a community of providers couldn't figure out the best way to reach. We knew these overdoses were happening. We knew these spikes were happening, but we couldn't get the information. When he's talking about the MOUs, you know, it's a lot of information that goes through dispatch, and we as providers don't need to have access to that. And we shouldn't without the proper channels. So the Sheriff's Department came back and developed this program to help respond to the community that we saw was struggling. And so far, it's really great. We're working on making sure that those overdoses that are getting sent to him are now being implemented into ODMAP. So certain things, if there's a spike, you know, Greener Pathways can put the van, you know, in an area that's close to the spike. So I think it's looking at why that ODMAP data can be important and how we can help respond as a community better.
Yeah, and also one thing I did leave out is we do leave Narcan behind. When we were halfway through the program, we were able to acquire Narcan to leave behind at places we respond to. And many times there's family members, not just the victim, the family members ask for assistance in dealing with this issue with their family members. So we also provide referrals for them to respond with MCAT. I leave behind my cell phone number. They could reach me anytime they want. I had 2 individuals so far in working with this program that initially said, yeah, I don't really have a problem and I'm okay. And a week later, they called me and said, listen, I do have a problem. I would like you to come back and speak with me. And I even did a group call with Katie with one individual and brought this person to get some help. So I do feel we're on the right road for at least on our overdoses and building trust within the communities with some of the programs the Sheriff's Office has started.
So George and Sheriff and Adam, Tracy, and everyone's on the call. Are there ways that we as the committee can better support some of these programs? How do we help this continue?
Well, I would assume, I think Carl had mentioned it before that we started this path and we want to continue down that path to keep building those relationships. I mean, the more contacts we make, the more we're able to deal with the same people that you are as we are, you know, and the more trust we develop, the better we're going to be at this at some point. I do also want to make clear before we end this thing that we do have an app which directs us to a link where anybody can get on this thing and make a complaint, a comment, whether it be good or bad, and it can be anonymous as well. So there are avenues to make those kind of complaints with regards to the Sheriff's Office anyway. But other than that, I think as George said as well, we're doing our best to move in the right direction. And to work with everybody that that has the best interests of the community in mind.
Any other questions for George?
Katie, I have a question unrelated to George. And I guess it goes to at least to Beth. It's going to be a joint question. I'm going to bring Joe Stanzioni and Angelo in at the moment too. But is there enough treatment in the community, or are some of our people who are struggling can't get someplace? There isn't a facility, there isn't a program, there isn't a counselor. Are we short on services, or are we short on getting people into services?
Well, I would love to address that. So as far as outpatient treatment, there's plenty of room for more people. I think the biggest problem for our community has been for many years that there's no kind of emergency services or a stabilization place for anybody to go like right then when they need to go. There is a group who has applied for and has received permission to start such a program, a stabilization center that is located in Hudson, not right down the road from their sheriff's department. They've been approved and the funding is like available. The problem is when COVID hit, you know, they were ready to build a building and they would have been up and running in like a year and a half or less. Everything has come to a grinding halt because of that. So right now, the state office and the dormitory authority, who actually provides the funding for these kind of facilities, is on hold. Everybody's on hold because they don't know what they're going to do with the capital money yet to go into these projects. That would be a wonderful thing for both counties, to have a place where when you meet someone and they're in need of a crisis bed and they may need to be detoxed, or they may need to have a mental health assessment, acute mental health assessment, instead of going to the hospital, they could go to this place and, you know, spend a few days, get stabilized, be referred to a good place. That's always what's been needed in our community. We've never had it. And now it's, like I said, on hold.
Can I also add something as well on the heels of that in terms of?
Sure.
One of the other initiatives that is just beginning as part of that Healing Community study is that we've been talking to Judge Taylor about starting an opioid court, similar to drug court, but specifically for crimes related to opioids, and that require and would help someone get in treatment immediately like that. So quick intervention, really, really important to seize those opportunities.
All right, Jason. Yes. Jason, good segue then for me, and I'll move to Joe and Angelo. Is the criminalization of use our problem versus getting people into a facility? Granted, getting people into a county jail sometimes is the first good step because it removes them from the environment that they're in. But is the criminalization of, I hate to say minor drug use, but let's just say generically drug use, should we be reviewing that?
Joe, do you want to touch that, or do you want me to go first? I mean, obviously, with our new bail reform, we're not getting people right into the jails. And I don't know if that's necessarily the best place, although with Greener Pathways and with our other facilities that we're housing people in right now, we're actually getting people into treatment a lot easier, whereas we were, as lay people, trying to facilitate some of that. And our Twin Counties is certainly there and available with definitely the outpatient. The long-term inpatient has been troublesome. The immediate detox has always been an issue, especially now that Kingston doesn't take people any longer. I think maybe there's Spark or something. So it is tough for us. We don't really have the services. We're trying. And now with COVID, I know we've got a lot of people that are staying in jail longer because we can't get them in. There's a whole new, there's a whole nother layer of delays. But we have seen some improvements, and I think we just have to keep plugging along. But there certainly could be more. And another issue that really goes along hand in hand with drug abuse or addiction is that a lot of people have mental health components, and there's like that whole dual diagnosis issue that these places just don't know how to handle that. So we really need something like that to really help us. But we're moving. We just have to keep going along. I think it seems like we've got a lot of initiative there.
Joe?
I don't think criminalization is a problem because a lot of times if you make an arrest, that at least we're able to get a grip on the individual who's involved in a drug situation. And then we have things like drug court, where if we can get the individual into a drug court program and that individual does very well, well then, that's taken into consideration and resolved in a case. Many cases will be reduced down from a felony to a misdemeanor. Some cases will result in a situation where a crime will be sealed. So I don't think criminalization is a problem. I think it's a big help because it gets the individual under control. And I think jail was a good thing. The bail reform, I think, has hurt many of these individuals who have substance problems, because when a person is out on the street, in his mind, he doesn't have a problem. When an arrest is made and that person is sent to jail, after a couple of days, when he dries out a little bit, he realizes this isn't the place I want to be. And now when you offer a program like drug court or an inpatient program, the individual is more receptive to that. And we've had many cases in the past where an individual was incarcerated and we would agree to transition that person from jail into an inpatient program. And if they did well in that program, they would roll into a drug court program. And if they did really well there, well, then the case could be resolved by reducing a serious felony down to a misdemeanor sort of offense. And that had been very positive. We had very good results. And these people actually have helped others on the path to recovery. So I don't think decriminalization, is the answer. I think bail reform is the answer. We have to reform bail so that we get some of these people in jail just to stabilize them for a short period of time. I had always argued that what we need are counselors in the jail so that when these individuals are arrested, they can immediately start receiving services, and then we can start planning on whether they're appropriate for drug court or inpatient treatment or programs of that nature.
Yeah, I would like to agree with that very much. And I would also like to say that over the many, many years that I've been doing this, I can't tell you how many people have said to me, whether in drug court or not, the best thing that ever happened to me was to get arrested and go to jail because I'd be dead. So there is a certain segment of the population, not everybody, but for some people, that was the wake-up call because they never thought they'd end up there. That it absolutely never did. And it was the thing and the pressure to go on to treatment from the court that actually got them into a recovery program. That's why they're there. I mean, I look at the women and the men in our halfway houses, and most of them are there because of some kind of judicial intervention. And they wouldn't be there if it wasn't for that. So, well, I'm not a huge fan of the bail reform that's happened because it's really let an awful lot of people back out to continue to use who would normally be in a place where if you had the appropriate counseling, which is a great point, Joe, you have to have that. There could be an intervention that was very valuable.
Veronica, you're chomping at the bit there, so go ahead.
Yeah, I know Veronica is.
I appreciate that, Beth, and I appreciate that it is true. I've also met people who've said that their recovery wouldn't have happened for them if they weren't incarcerated. But I think that within the criminal justice system specifically, we're really looking at extremes. There are people
Yes.
for whom this works, but then there's the reality that we're dealing with is that this is an opioid epidemic, and any period of forced abstinence increases someone's risk of death substantially, right? So there's data that shows that even just a short overnight stay in jail, when you come out, your risk of death is increased substantially because you're messing with people's tolerance. I think we
That's
just
why they need an intervention while they're in jail.
And the transition
I
into.
agree with you. It's not for everybody.
It is the release still, though. Don't quote me, even though this is recorded, but I want to say there's a study that said that there's 128-fold increased risk in overdose for people who are within 2 weeks of release from jail compared to the general population. 128-fold, I
Yeah.
think. So it's a huge risk.
Right. So if they go from jail into an inpatient program and then into a residential program, they have a better shot.
Right.
And everybody gets that opportunity. I totally understand that. And
As one of the questions
Right.
that came up, I think, at our first session about the construction of the new county jail.
yeah,
Part of the whole premise of the new county jail is the re-entry facet of your
Yes.
stay. You know,
Right.
I will certainly agree that for the last 100 years, the county jail has warehoused people. We haven't done anything really for them during their stay because the facility wasn't built like that. It was built in
Right.
1903.
I get it.
The whole new facility that's being constructed, the whole focus, or much of the focus, was to not just show somebody to the door at the end of their sentence, but to then lead them and hand them off, if you will, to an agency, and the agency is prepared to accept them upon release. We haven't done a good job at that in the past. So part of the design of the building is to have these re-entry efforts. If you need to have a Suboxone upon release to keep you straight and narrow so you don't fall right back into that same circle of friends, let's say, that's how part of the design here is. So I'm kind of in between of both Joe, I guess, and Veronica. And I come back to the terminology that Kai used earlier about the stigma. I'll even take it as far as to Dr. Cook in the educational program. In my former years in education, I always didn't like the term the GED graduate from high school. To me, that was a stigma. For some reason, I couldn't go to conventional school, but I got this thing called a GED, and therefore, anytime I filled out a job application, is somebody looking at the application and saying, "Oh, you got a GED." So terminology is, I think, a very big portion of this. And the ACD concept of somebody who has been arrested, who has successfully gone through a program, is there a way for that to be sealed so that I can fill out a job application, that I'm not going to have that stigma following me for some number of years after I've recovered? Emphasis on recovered.
Correct. And there is that possibility with the consent of the judge, naturally, that would be argued by defense counsel. And now the law has even changed. So after a period of 10 years, certain convictions can be
expunged.
Yes.
Okay. I'll go ahead, Kai.
This is a very complicated topic, actually. And I don't disagree with that path that works for some people, but also just want to recognize that, we don't necessarily want to take someone's self-determination away from them and force them into, something that they may or may not be ready for. It works for some people, but it certainly does not work for some people. And then you see the recidivism, the same people coming, same, and it just never works. And they're stuck in that cycle. So like, how do we, I don't have the answers, but just recognizing that that path does not work for everybody is hugely important for the recovery community. And so, and that model is based on abstinence too. And abstinence is not always a reality for people, whether they take medicated assisted treatment or whether they're medicating themselves instead of doing opioids, they're now at home smoking marijuana instead. You know, there's so many different levels to consider, and you know, it's really, really complicated. And again, I don't have the answer, but I just want to put that out there, that's a reality, and my recovery looks different than the next person's recovery. And if my recovery is recovering from opioids and I haven't touched that and I want to be abstinent to that, but I want to do another substance, maybe that's a little bit harm reduction. Whether it's a lateral move or it's an actual harm reduction move, I don't, you know, it's very complicated.
It is true.
Yeah.
If we had the answers, we probably wouldn't be in these chairs that we're sitting in either.
Of course.
All right, people, it's kind
Wait,
of.
so before I officially hand it back to Sean, I really want to acknowledge Laura Churchill on the call. I know that COVID is not something that we're tackling as part of this committee, but she literally went from COVID testing for the county and all the things that she's doing and found time to jump on the call. And so for all the things you're doing for COVID, I really want to thank you and your whole department. Yeah. Thank you.
Thanks, Katie. I appreciate that.
All right, so it is kind of getting to the bewitching hour. I think before though we wrap up, do I want to go around the room here? Does anybody have a question, comment, concern about tonight's presentation? Certainly substance abuse is not a new issue. I think it's probably been studied and reviewed for 100 years. And unfortunately, it may not be going away anytime soon either. So I don't know if there's anybody will have a comment. Do you have a question? Do I need to follow up either at any of our next meetings? Do you need additional information? So I'll just go around the room. Rabbi Zoe, you got anything you want to start with?
I just want to say, really thank everybody who presented tonight and say I'm so comforted knowing that you're all doing the work that you're doing and that you're there. It's fabulous to find out what you're doing, and just thank you to all of you. And Katie, thank you for setting this up. It's greatly appreciated.
All right, thank you. I'll move to Jeff Friedland.
You're on mute.
Unmute.
Find your mute button. There you go.
I was hitting the space bar, but it wasn't working. It's supposed to. Anyway, I'd just like to thank all the speakers. You know, my work with Beth on the Greene County Rural Health Network, we've been trying to tackle these issues for a really long time. And I you know, I think that certainly mental health and addiction seem to go hand in hand, at least in our area. And we really, it's a huge issue. And we've discussed it at other committee meetings. You know, how do we give the folks in law enforcement either the tools or the support necessary to make sure these interactions go properly? And I think that's something we're going to have to take this information we've received tonight and see if we can put that together somehow. So,
all right, Reverend Turpin.
Good evening, everyone. Thank you for sharing with us tonight. I definitely got some things from your presentation that I would like to bring to our committee. I'm hoping that Linda took the minutes. Did Linda take the minutes tonight, Sean?
I hope so.
Okay. There's some things that I noted that I think that will help us get a little closer to the goal. Thank you so much.
All right. Dr. Cook.
Yes, again, I want to thank Katie for arranging the presentations. I really learned a lot. Thank you to the presenters. Again, a lot of information was learned, especially about all the great things that we're doing in the community. And that's just going to help us as a committee to help move things forward with our recommendations for the reform. So thank you once again. It was a pleasure and job well done.
Thank you, sir. Sheriff Kaminsky.
All right, finally figured out how to unmute. Yeah, I just want to thank everybody for all their help, and I do want to reiterate that we are certainly listening and seeing if there's any avenues we can take to make the relationships better and move forward. Thank you all.
Okay. Mr. Slutsky from the mountaintop.
Yeah, I too want to thank all the speakers. I'm very impressed. I was not aware of so many different agencies or departments working on these various but related issues. And it sure seems as if Greene County, of course, along with Columbia County, but you would expect that over there, is definitely on the right track and going at the right pace, I think, with this particular issue. I do think, though, that going ahead for us, we need to look more at race-related issues, which is what I think this entire situation grew out of to begin with. And, you know, I don't know how we're ever going to handle that. You know, we literally have, what, 2.5 months left. But if I didn't say it already, I think I did. I do want to thank everybody for this. I also think the Zoom thing worked so much better for me because I can't hear squat to start with. So everybody's speaking on a microphone without a freaking face mask. It was so much easier for me to understand. So thank you all. Appreciate it.
All right, Gary, thank you. I agree with you. I think we have yet to address the issue of that I think spurred this overall governor's action, and that is race relations and the relations with law enforcement. I don't want to dance around the eggshells anymore. Perhaps at the next meetings, we can get down more to what I would call brass tacks, and maybe some discomfort levels with our ability to interact and talk to each other. So I think we do need to get that on the table. I think an event like tonight, certainly there are underlying issues in the community that lead to interaction with law enforcement. You know, no, we're not Portland, we're not Chicago, but that doesn't mean we don't have underlying issues at the same time, perhaps not at the same magnitude that they do. So thank you, Gary, for bringing that up. Joe Stanzioni.
I'd just like to thank our presenters, provided much insight. So thank you very much.
All right, thank you. Angelo?
I would just like to join in and thank everyone, but what Mr. Slutsky referred to is something we need to tackle. And what Kai mentioned earlier is the perception. It may not be actually happening, but if people feel it, how do we make everyone feel more comfortable? Because we're not seeing too much here of any incidents, but is there something that's keeping people from coming forward? So it's something you might want to try to address, but thank you. And I do like the Skype work better because I can't hear either. So.
All right, very good. So that's the committee, but just because you took the time tonight, I will also, for our speakers, I'll give you the opportunity as well. Laura, thank you for joining in tonight, but I'll give you time. Do you have any final closing comments?
No, I'm really grateful that you guys are undertaking this work, and it's big work, and I am hopeful that good stuff comes out of it.
All right, thank you, Laura. Beth Schuster?
I can't tell you how happy this makes me because 10 years ago, nobody was dealing with drug and alcohol problems between County Recovery Services. And the fact that we have so many people involved in this now and so many people aware, you really can't imagine how pleased this makes me. And thank you, everybody. And there's tons of things we can disagree on, but I think we can agree on more than we can disagree with. And that's special. Thank you.
Thank you. Veronica.
Echoing Laura and Beth both, it's been a real pleasure to be here tonight, but also to have the opportunity to get to know all of you and to do a little bit of work in these communities. I've only been on the project since January. It's really been a joy to work with you, especially during this time. And maybe I got lucky getting pulled out of a out of a health department, right? So I'm not actually doing the COVID thing. I'm curious what the final planned outcome of this process is. Will there be like a report?
Oh, yes. Yeah, we are obligated to, so this committee, as well as the other 7 law enforcement agencies, they all have to go through the same effort, and they all have to issue a report that has to be adopted by their respective legislative bodies. So in this case, the county legislature will review a report that this committee will then author, and either support it, maybe dissent on it, whatever. But we have to have it in the governor's hands by April 1st. So the clock is ticking. Of course, we have the holiday season approaching. That'll be making it a little more difficult perhaps to get together, but I'll agree with Mr. Slutsky. I was a little fearful that tonight would not go well. I'm not a Zoom person too comfortably to begin with, but I think it did work a little bit for us. So we will be meeting again in January, February, probably issuing a draft report in March, and then my board would have to issue it by April. Okay. All right. Jason Fredenberg.
Yeah, real quickly, I just want to thank everyone as well, the committee members as well. I think this is a really important issue, and it's so important to address because to be complicit and to not look at it or to not explore it is can also do a real disservice. So I think it's really great that the committee's looking at it. Also want to just quick shout out to all the presenters tonight, all these other agencies that we work with. I hope the rest of you on the committee that heard the presentations tonight know how awesome all these agencies are. I mean, really the work that everyone's doing, you know, I mean, just looking at everyone here, Carl, Katie, Laura, Kai, Beth, I mean, it really, it's a great network, and I'm really proud to be a part of it. So I'm really glad that all of you are getting a better glimpse of that. So
right, thank you, Jason. All right, Carl.
And I too just want to thank the committee for taking the opportunity to listen to the concerns that we have as providers in the agency working with this population. It gives me great hope that the conversations are happening. I know the conversations will continue, and you know, I'm thankful to be part of this great group of people that we work with, and continue to do what we can do to help people in Columbia and Greene counties. Thank you.
Thanks, Carl. All right, our host this evening, last but certainly not least, Katie, thank you first off for getting in contact and drawing in some people, you know, pulling a string or asking for a favor, whatever. But so I'll give you the last focus before I move back to the committee and general organization.
So I know that this is being streamed live on YouTube, and I'll let Kai finish out because I don't think he got a chance to say his last final words there. But I know I missed people, and I think for time when you're looking at communities and organizations, kind of focused on the people that are immediate out there doing stuff. So I don't want the community at large to think we forgot about them. Just to throw that out there.
Okay. All right. Then
but Kai, you go right ahead.
Go ahead, Kai.
Cool. Thank you, Katie. That's a good point. It's very difficult to get everybody in. I just want to mimic everything everybody has said so far and include, I want to thank the Sheriff's Office for taking this seriously and organized and being.
Oh, we lose you?
As the presenters, you guys are all awesome.
All right, thank you. All right, committee, then we had discussed a second December meeting. I believe we talked about January 22nd or 23rd. I don't know if it's pretty close to the holiday. Do you want to take the rest of the month off and then just maybe do more of them in January? You know, nothing says we have to just do 2 meetings a month, but I know everyone's got schedules. I have board meetings. Dr. Cook has board meetings in addition to these nights out. So I guess I'm open to your purview.
I think a meeting in January would be appropriate. I don't know about another one in December. It's kind of close to the holidays.
It is, and you know, next week I have 2 nights out for my board meetings, and then the short week will be going into Christmas. So that was my concern, and I would hate to schedule a meeting and not have full attendance and have somebody miss out on whatever the dialogue is that night. So we also had a tentative schedule in January. I don't have it in front of me. The 9th and the.
I think it's 13th and the 27th.
Thank you, Joe.
That's correct.
Is everybody still okay with at least those 2 dates? Warren, is there a 5th week in January, the way the calendar falls?
I don't think so.
I don't think so, but I'm checking now.
Okay. So while you're checking, I guess then for the committee, in terms of content and agenda development for January, is there something that you want me to get into? Either be it a speaker, or do we just want to hash some things out, ask some questions? I prefer us to get uncomfortable, if I could use that terminology, and push this envelope a little bit.
Sean?
Go ahead, Rev.
I'm looking forward to when we can sit down together before the trail gets cold, that we use the information that we have and really try to put our teeth into what we have. And then if we don't have enough, then open up to some more presenters. But I mean, we have a lot. And if we keep adding on more information, we're going to get covered in information and really don't have enough time to remember or to have it put down to get across the goal.
I agree.
That's how I feel about it.
Yeah, there's that old academic saying, analysis paralysis. You keep on researching, and you never come up with anything. So between the minutes that have been generated for these meetings and my notes, and I'm sure everybody else is taking notes, I will put together, I guess, some bullet points that have struck me through these sessions. I'll try to float them to everybody prior to the January meetings to try to get some conversation moving and get some topic points. And then, so I think the consensus, I see a lot of heads shaking. The consensus is perhaps the January sessions, those 2 sessions, it's just committee. And then February, depending upon how we move out of those 2 meetings, we could go back into a public session at that point. And then in then in March, we're going to have to release something so that our boards, at least my board, then can have it on their agenda in March in order to adopt and send on to the governor by April 1st. So if everybody's okay with that, then I would ask for a couple of head shakings, and then I can get some consensus. Thank you very much. Thank you very much. All right.
Sean, there's one thing I'd like to ask or add.
Shoot.
The organizational meeting we had at the legislative chambers, there was a woman, I don't know if she was a young woman there from Catskill, I think from Hoppeno's grandmother, who hasn't been back. I had hoped that she would be an asset as far as bringing in a whole different viewpoint, obviously.
Yeah.
And I don't know if she has been able to attend because she has to babysit, or if it's a childcare thing or whatever it is. But if she can't make it, I think that, or if you don't know, maybe you can reach out to her. But if she can't make it, I think we need to add somebody, possibly, even though it's kind of late in the game, for a little different viewpoint than what we have among ourselves.
She did pull back a little. Yes, there was a child care issue, but I also think, I'm not sure if she was just overwhelmed, but she did kind of say to me that she probably would not return to the sessions. She's not she doesn't have an internet presence. You know, she couldn't participate in a session like this unless we actually joined somebody. But I certainly will reach out to her. I mean, I think she had some issues that she brought up at that meeting that she faces in the public housing standpoint that, you know, may be worth us. If she can't come in person, perhaps I can at least get her to give me something in writing to bring to us for the January, February sessions. But good point, Gary. All right, anybody else there? Last call. All right, if not, I wish you all a very merry season, Merry Christmas, Happy New Year, and let's hope this vaccine starts rolling pretty quickly, and let's all say goodbye to 2020 pretty quickly, I guess, as best we can, because it certainly hasn't been one of my favorite years, I'll tell you that right now. I'm just finishing up my second quarantine and still with no symptoms, but I'm home, and my dog's going to be pretty lonely come Monday morning. No offense, Rabbi. We all saw your cat loping around the desk. I think if I saw it, Kai let somebody out the door a minute ago too. I think so. So dogs rule and cats drool, I guess the saying goes. So at any rate, everybody have a great night, and I'll keep in contact with you and have a happy holiday.
You too. Good
Thanks,
night.
everyone.
Happy holidays.
Thank you.